Now, what is the problem? Oh, sorry, what are the main benefits? So, first, it is beneficial for children, elderly, and pregnant females. Why? In children and elderly, the heart muscles are not so strong. Heart muscles are not so strong. In pregnant female, the blood volume is already very high. Now let's say there is a child, or let's say there is a elderly patient. Now this elderly patient has got anemia, severe anemia. HB is 3 gram per deciliter. Fine. Even though this patient has anemia, his blood volume will be around 5 to 6 liters. Now you have two choices. One is you give whole blood. Second is you give packed cells. So that means after you gave whole blood, his blood volume will be 5.5 liters. And if you give packed cells, his blood volume will be 5.25 liters. Now, this extra 250 ml which we give in whole blood, it causes immense strain on the weak heart muscles. You know, every time the heart has to pump 250 ml extra blood. Fine, 250 ml extra blood. जब आप लोग अपने माइक को म्यूट कर लेते हैं तो मुझे डर लग जाता है कि पता नहीं क्लास
है सर, है आपके साथ है।
वो इंटरनेट का पता नहीं क्या पंगा है यार. It causes immense strain on weak heart muscles. So your patient may suffer from cardiac failure. Patient may suffer from cardiac failure. That is why packed cell is much important. Packed cell is much more important. Fine. Especially in these patients. Fine. Now, what do we do is, so these cells can be cryopreserved. How do we cryopreserve? So we store them at minus 80 degree centigrade. So that means it is converted into powder. Form. Fine. Now, this product is not useful for emergency situation. This product is not useful for emergency situation. For example, some patient in India has O negative blood group, rare blood group in India. Fine. Now what happens is, there is a patient of O negative blood group. He is brought to emergency with a gunshot wound, bleeding profusely. Now, you ask, is there anyone who has got O negative blood? Koi khada nahi hoga. Fine. So what do? You ask the blood bank officer that we have lyophilized, we have cryopreserved packed cells. Please bring them on immediately. He will say, sir, it will require minimum 90 minutes. 1.5 घंटा. 1.5 घंटे में आपका मरीज मर जाएगा. Fine. So they are not useful in emergency. Fine. So they are not useful in emergency because the preparation time is minimum 90 minutes. Preparation time is minimum 90 minutes. Minimum 90 minutes. Right? Okay. Now, there's one thing more. Just a minute. Yes. So, from the whole blood, what you did was you removed large amount of plasma, and what remained with you was packed cells. So that means because large amount of plasma is removed, that means this solution is very, very dense. बहुत ही thick, बहुत ही गाढ़ा. Fine. सारा liquid तो आपने निकाल लिया. Only solid part is there. Fine. So this may require this may require more time to be injected because it is very, very thick. Fine. May require more time to be injected. So what we do is we use a device which is called Y connector. Now what is Y connector? Y connector is a device like this. Fine. So from here we will inject blood. From here we will inject saline. Fine, like this. Right? So this blood is very thick. Now when this blood will mix with the saline, it will become less dense. When it becomes less dense, it flows easily. Right? So this is all about the red cells. Now, the second component here is leukocyte poor blood. Now, for example, there is a patient. Now, this patient has had kidney transplant. Let's say this is the transplanted kidney. Fine. Now, जब इस पेशेंट का किडनी ट्रांसप्लांट हो रहा था, when this patient was undergoing kidney transplant, what happened was there was massive amount of blood loss. So this patient requires blood transfusion. Fine. Now, suppose you gave this patient blood. इस पेशेंट को आपने blood चढ़ाया. Fine. Now, what kind of blood you gave? Suppose you gave this patient whole blood. So this patient has got, this blood has got WBC, this blood has got RBCs. Fine. So the WBCs, which are pleasant, WBC means white blood cells, they will destroy this kidney. They will damage this kidney. Fine. So what will we do? In this patient, what we will do, that the blood which is to be given to this patient will pass through a filter. This blood will pass through a filter. Now, what will this filter do? This filter will remove all the WBCs. So these black dots, they are WBCs. Fine. All the WBCs will be removed and only fresh blood will flow. Only fresh blood will flow. Fine. So the WBCs are trapped by the filter. Trapped by the filter. Fine. So this is prepared by filtration method. Prepared by filtration method. So most of the WBCs, white blood cells, are removed. Are removed. Fine. So this is used in patients undergoing transplant surgeries. Patients undergoing transplant surgeries. Second, patients requiring multiple transplants. Patients requiring multiple transplants. Third, it is also useful in the patients who had developed adverse reactions in the past. आप पेशेंट को बोलते हो कि ब्लड चढ़ाना पड़ेगा. आप पेशेंट को बोलते हो कि ब्लड चढ़ाना पड़ेगा. फाइन. पेशेंट बोलता है डॉक्टर साहब मैं 3 साल पहले एडमिट हुआ था एक प्राइवेट हॉस्पिटल में, वहां पे भी मुझे ब्लड चढ़ाया गया था, लेकिन जैसे ब्लड चढ़ाया था पूरी बॉडी कांपने लग पड़ी थी, शरीर पे रैशेस हो गए, सांस उखड़ने लग पड़ा, प्रॉब्लम्स आई थी बहुत सारी. Fine. So the patient comes to you and says that doctor, when 3 years before I was admitted in a hospital, I developed multiple complications after blood transfusion. Fine. So in these kind of patients, you will give leukocyte depleted packed cell. Leukocyte depleted packed cells. Fine. Now, even in this blood, the WBCs are not completely absent. But their count is less than 5 into 10 to the power 6. Fine. If you say that I don't want to see even a single RBC, so those are called as washed RBCs. Fine. Washed RBCs. So that means WBC and most of the antibodies are removed. So this is done with the help of radiotherapy. Fine. So we will give radiation to the blood bag, which will destroy most of the WBCs. So you can safely use this blood for renal transplant patient. Fine. So last 2-3 minutes, then we'll take a 5-10 minutes break. So the next component is fresh frozen plasma. Okay. Now, why the word fresh? एक चीज ध्यान रखनी है that plasma is mainly used for clotting factor deficiency. दूसरी आपने क्या चीज याद रखनी है? Factor 5 and Factor 8 are heat labile. That is why the plasma which is separated from the whole blood is frozen. Now, why the word fresh? The word fresh means the plasma is frozen as early as possible. Fine. So it should be done within 8 hours. It should be frozen within 8 hours. Should be frozen within 8 hours. Why it should be frozen within 8 hours is to preserve the clotting factors, Now suppose you could not freeze it within 8 hours. You should still freeze it because the next component is PF24. So PF24, as the name suggests, it is the plasma which is frozen within 24 hours. So it is certainly not the best, fine, but still has large amount of clotting factors. Fine. Large amount of clotting factors. Okay. Now, there is another component which is called as PNF. So PNF is plasma which is never frozen. Plasma which is never frozen. Now, because it is never frozen, fine. So some clotting factors may undergo depletion. Some clotting factors may undergo depletion. Fine. So it is not very good for use as compared to fresh frozen plasma. Fine. Now, with this, I would like to take a break. So it is 12:47 by my watch. So 12:57 will